Hello everyone, today we are going to talk about Glasgow Coma Scale, commonly known as GCS. The Glasgow Coma Scale is a neurological assessment tool designed to offer a dependable and objective means of documenting an individual's conscious state. It serves as a valuable resource for both the initial and ongoing evaluation of patients, particularly in predicting their ultimate outcome. The Glasgow Coma Scale was first published in 1974 at the University of Glasgow by neurosurgery professors Graham Teasdale and Brian Jennett. Generally, comas are classified as minor, moderate, and severe based on the GCS of the patient. If a patient has GCS of 13 or more, it is classified as minor coma, a GCS of 9 to 12 as moderate, and a GCS of less than or equal to 8 is defined as severe coma. Let us now have a look at the GCS scale. This picture is taken from Frank Netter's Atlas of Anatomy, and this is an old version of the GCS scale, but all new versions are also based on the same principles of checking eye opening, verbal response, and motor response. For eye opening, the maximum score is 4, for verbal response it's 5, and for motor response it's 6. So you can remember it by EVM or 4, 5 and 6. Let's start with eye opening. If a patient is opening eyes spontaneously, which means that he is looking here and there without you asking him to do so, then you are going to give him a score of 4. If you have to ask the patient to open his or her eyes, then you will give a score of 3. If the patient is not opening eyes on asking, you have to give a painful stimulus. Over here we can see that a painful stimulus is being given at the supraorbital ridge. You can also give a painful stimulus at the sternum. If the patient opens eyes to a painful stimulus, you will give a score of 2. If the patient does not open eyes whatsoever, then you will give him a score of 1. Next, checking the verbal response. You are going to ask the patient his name, the place where he is at, or any general question. If the patient gives a correct answer, he is oriented. If the patient is confused about what he is saying, for example, over here the question was, what year is this? Actually, the year was 1983, and if the patient said 1983, we will give a score of 5. But if the patient said 1972, this means that the patient is confused, so we will give a score of 4. If in response to this question, the patient says, yesterday mother, this means he is saying inappropriate words and he does not know what is being asked. So we will give 3 for inappropriate words. If the patient is not even able to say a single word but is producing abnormal sounds, that is, the patient starts screaming, moaning, or groaning, you will give a score of 4 for incomprehensible sounds. And if the patient gives no response whatsoever, you will give a score of 1. Next, we are going to check the motor response. You're going to ask the patient to lift his hand or to show 2 fingers. In this example, the patient is showing 2 fingers. This means he's obeying command, so we are going to give him a score of 6. If the patient does not obey your command, the second thing to do is to give a painful stimulus. Again, it is being given over here at the supraorbital ridge. The patient moves his hand to pull or push your hand away, so he is localizing to the pain, which means that he is bringing his hands towards the area of pain. Then you are going to give a score of 5. This is another technique where a doctor is tapping the nail bed of the patient's finger with a pencil or a pen, and the patient withdraws, which means pulls away his hand. So this is also an abnormal response, withdrawing to a stimulus, and you are going to give a score of 4. If to your stimulus, patient has an abnormal response like this is known as extensor response, and you are going to give a score of 2. Whereas if the patient flexes his elbows in this manner, this is abnormal flexor response, where in this case the patient is flexing his arm with the help of contraction of bicep muscle, and over here you can see an abnormal extensor response because of the triceps muscle, where the arms are in the extended position. So in this case, either a score of 2 or 3 will be given. If there is no response whatsoever, you are going to give a score of 1.